So, welcome to this episode of Conceptual Anesthesia, and we'll be talking about a very important topic, which is more relevant in India than anywhere else in the world, and that is snake bite management. In many parts of the country, snake bites are still one of the leading causes, and we actually don't know how to manage these patients, how to go about treating these patients, how we can do better, what are the do's and what are the don'ts. So, we'll be discussing about it, and the majority of things have been taken from the recent articles and the national guidelines, which are very vast and which are very relevant. So, snake bite is an acute, life-threatening, time-limiting medical emergency. So, as we all know, it's an acute, life-threatening, but also it's a time-limiting medical emergency. And this is a preventable public health hazard, and it's often faced by rural population in tropical and subtropical countries with heavy rainfall and humid climate. And although the total number of bites may be more than 5 to 6 lakhs, but only 30% are venomous. Venomous means they are poisonous. So we should remember this one fact that only 30% are venomous. And the issue is that what is the treatment quality? It is highly varied. Some people are very aware and some people are not at all aware. And that is why, as an example, in the literature, it has been found that high fatality is seen due to many of the snake bites because of the non availability or inappropriate or delayed administration of anti snake venom, lack of standard protocol for management, and inexperienced doctors and non availability of the medical facilities. Sometimes what happens is because of availability also, but since you are not aware of these things, victims are misdiagnosed. So patient may present with abdominal pain and you may misdiagnose such patients. Patient may present with neuromuscular weakness. They can also be thought of hysteria or GBS and subjected to usually things like MRIs and lumbar punctures rather than thinking about the giving an anti-snake venom. And sometimes what happens is there is delayed administration. So all of these things, misdiagnosis, delayed administration, irrelevant test can also relate into a higher number of fatalities. So what is, as I told you, 30% of the bites are venomous. And even when the venomous species bite, almost 50% of their bites are dry bites. That means they don't inject the venom. So only 15% of the patients who actually come with snake bites have bites with venomous snakes and they have injected the venom. So this is a very important fact that around 85% or 85 out of 100 victims will not require any treatment and there is nothing wrong with them, even though supposedly a snake has bitten them. What are the major families of venomous snakes? Elapidae, that involves the cobra, krait, and the coral snake. Then the Viperidae, the vipers, and the sea snakes. These are the three families of venomous snakes that are available in Indian subcontinent. So this is how the common snakes look like. Remember the venom of the snakes, their effects can also have a regional variability. That is why if you go through the literature, it has been emphasized that regional anti-snake venom should be there, regional protocols should be there, regional like antimicrobials and antibacterial, the regional flora, you should also know the regional snake flora of your areas. So something about the cobra, these snakes have a head that is about same width as their neck. Head is covered with large scales and grooved fangs that are short, fixed and covered by mucous membranes. Whereas the vipers, the head of the viper is triangular, wider than the neck, and the fangs, as you can see, are long, movable, and canalized like hypodermic needles. The vipers can be subdivided into pit vipers and pitless vipers. So in the pit vipers, they have a special sense organ, what is called as the pit organ, to detect the warm-blooded prey. So usually when the patient comes to you with a snake bite, you can show them the pictures. It's not necessary to for them to carry a dead snake or to try to kill the snake as it was previously thought. You can actually show them the pictures and help them identify which of the snakes is there that has bitten them. It's an easier thing than actually killing a snake and putting yourself or somebody else in the danger of a second bite. Now we come to the clinical features. Remember, the clinical features vary from the age and the size of the patient, the species of the snake, the number and location of the bites, and the quantity and toxicity of the venom. And morbidity and mortality depends on the age and the size of the victim as well as the comorbid conditions. So children who receive a larger envenomation relative to their body size are more at risk. The snake won't know whether it's biting a children or adult. An elderly patient may succumb more easily to the snake venom. And factors which do not contribute are the size of the snake and the time of the bite. It can come as a multiple choice question. Which of the factors do not contribute to the outcome after a snake bite? The options can be size of the snake or the time of the bite, that is day or night. So the size of the victim, bigger the size, good is the outcome. So in children receive larger envenomation relative to their body size are at more at risk because there is high amount of toxin per kg of body weight that is injected by the snake. If the patient has some comorbidities like old age, anemia, hypertension, renal disease, they are more prone. If the patient is bitten on the trunk, face, and directly into the bloodstream, he has a worse prognosis. If you have exertion, it leads to a poor outcome after a snake bite. And sensitivity of an individual to the venom also plays a role. Then bite number, depth of the bite, whether it's a dry bite, bite through the clothes, amount of the venom injected, condition of fangs, although they all affect, but you have no control over it. Different species of the snakes have different lethal dose, lethal period, and aggressiveness. And the nature of first aid given and the time elapsed before the first dose of antivenom. So this is in our hands. How you give the first aid, what is the time elapsed before the first dose of antivenom? This is definitely in our hands and we should focus on this. So the management consists of these things and I'll be talking about each of them in a big detail. So first is the first aid treatment and the transport to the hospital. Second is rapid clinical assessment and resuscitation. Third is investigation and laboratory test. Then is clinical assessment and species diagnosis. Then antivenom treatment. And when you give antivenom, you see the response to the antivenom and whether you need to give a further dose. What is the other treatment that you need to give? So remember, first aid is immediately to be carried out even before the patient reaches a dispensary or a hospital. And it can even be given by the patient or the person himself who has had a snake bite or anyone who is present besides the patient or the person and is capable of doing it. So remember, the earlier the first aid is, the better it is. The earlier the transport to the hospital, the better it is. So aim of the first aid is to attempt the retard the systemic absorption. So the snake has bitten, but you want that the venom that has been injected should not go into the systemic circulation. So you want to retard the circulation or retard the absorption of the venom to preserve the life and prevent complications before the patient reaches the medical care. Control dangerous early symptoms of envenomation, and you have to arrange the transport of the patient to a place where they can receive medical care. So you have to send the patient to a place in the place where the patient is used to being treated, the place where the antisenic venom is present, the place where other medical facilities is there. So these are the steps given by the national guidelines. So check the history of the snake bite and reassure the patient because some symptoms which are there by the fear of the snake bite or the hysteria around the snake bite, most of the snake bites that is around, as I told you, 70% are non-venomous and out of the 30%, 15%, that is 50% of the bites are dry bites. Now, earlier we had the patients who were carrying a very high tourniquet, which was limiting the circulation. Maybe that is still prevalent, but the thing that has been, according to the guidance, is immobilized like a fractured limb. So, as you can see the picture, the patient has a snake bite in the hand, and we are immobilizing the limb like a fractured limb. So, we use bandages or clothes to hold the splints, but do not block the blood supply or apply pressure. Ideally, the patient should lie in a recovery position because of neuro symptoms. The patient may be not able to protect his airway and may aspirate the vomitus. So the idea is to prevent aspiration. So put him in the recovery position and immobilize the leg like described in the image below. Do not feed anything by mouth till the victim reaches a medical facility. Traditional remedies have no proven benefit in treating snake bite. So earlier we used to be familiar with the traditional remedies, but they are in vogue because only 15% of the patients actually need a treatment and 85% get fine by their own. We have to shift the patient or victim to the nearest health facility and you have to arrange a transport. so that the patient reaches the facility quickly, safely, and passively. So usually, as a motorbike is a good mode of transport, so one of the person drives, then the patient is in the between, and somebody stabilizes the patient from the back so that it doesn't fall off, and you take it to the facility as soon as possible. If possible, in the days of WhatsApp and phone, you can actually inform the doctor of any symptoms. Remove shoes, rings, watches from the better area as it can be acting as a tourniquet, and leave the blisters undisturbed. So this is a mnemonic, what is called as do it right. So reassure, immobilize, no tight bandages, get to the hospital, and if there are telltale signs, tell him immediately. It is very important to note these facts because they are still prevalent when the patient is bit by a snake. We should not attempt to waste any time to kill or capture the snake. This can actually only waste time, and if the potential bites are there in future, it can lead to more victims. However, if the snake has been killed, then you can think about taking it, but do not be brave and hold the snake in your bare hands, and do not apply or inject anti-snake venom locally.